Good afternoon, friends. One of the pitfalls of being the last speaker is that you get squeezed between two sessions. So I'll try to do justice within 10 minutes given to me. My presentation, please. Actually, I must confess that the social module that we had, the social sector module, which Mr. Amarjit Sinha used to lead in the academy, had an impact on us. And when we went to the field, I think quite a few of us tried to do as much as possible to improve the service delivery. And health being the sector which I love the most, we have tried a number of innovations in the delivery system. I'm going to share one with you, but I'm going to mention 4 or 5 of them. My presentation is different. The innovation I'm going to talk about is the ANC and PNC tracking system. But apart from that, we started an RTI and STI project. This is Reproductive Tract Infection and STI project, in which we used WHO guidelines, syndromic guideline, to gauge how many people, to do a survey, how many people in the Wardha district may be suffering from RTI, STI. We did a cross-sectional study in a taluka. From that, we extrapolated the number, and what we did is we made a very simple form in which the symptoms, symptomatically, the name of the person, what are the symptoms which is there, and given it to the ASHAs and the ANMs to conduct the survey in every house-to-house survey. And after taking the forms back, we had a software where we put the whole data in the software, and we found out how many people are possibly suffering from the RTI, STI based on the symptomatic study. And after that, we call them in a sub-center for a checkup. So after the sub-center checkup, we give them a WHO guideline syndromic treatment to all the patients. This is one of the projects we did, and this has been included in the PIP of this Maharashtra government. Another study which we did is in the 27, we did a pilot project of special nutrition program, and the impact we did have on the pregnant women, on the child. So we did a 27 experimental and the control villages, and we provided them a 1400 kilocalorie of nutrition, one-time meal every day for 4 months, and did a whole study and tabulated the data and gave it to the government. And in fact, in the house, the minister had made a thing in the areas where the malnourishment is prevalent, they'll be starting with such a program. We also have a web-based inventory management system for medicines and consumables at district and PHC level, wherein at the click of the button, actually sitting in my office, I can know in which PHC, how many medicines are there, what are the expiry date, and we can manage our inventory system well. Similarly, we have gone into a public-private partnership with the 2 medical colleges for the provision of doctors and specialist services at the PHC level. We have given these medical colleges, I have 2 medical colleges in Wardha, we have given 3 PHCs each to these medical colleges, and they are the ones who are providing us with 2 doctors and also the specialist service. On each week, there is one specialist, say for example, gynecologist or pediatrician, is sitting and looking after and catering to the general population. Also, we have started for a village level child development centers. Basically what happened is the entire focus had been on the grade 3 and 4 of undernourishment. We somehow, in say for example, Wardha district, I have only 45 to 50 children who are actually grade 4. The problem is that we have more number of children who are in the grade 1. That is a lower level of malnourishment. So what we did in our district is that we started focusing with the help of the Village Health Nutrition Sanitation Committee and the Gram Panchayat, because every Gram Panchayat is supposed to be spending around 20% of their total budget for women and child development. So we have asked them to put in their money, and from that we provide a nutrition program to the children who are suffering from the grade 1 and the grade 2 of undernourishment. Similarly, we started a scheme called Nirame, which is the provision of affordable services to people. This is not so much to do with the government, but it is done more so in the private capacity. We have come together with a group of the doctors, both the private sector doctors and the public sector, and we provided them a comparative list of drugs. Say for example, a cetrizine is made by many manufacturers, So we provided them that there are good manufacturers. There is one which is selling you at 45 paisa. There is another one selling you at 20 paisa per tablet. So why not, when you're prescribing to the poor patient, why not prescribe a 20 paisa one, which is of good quality? So coming to the ANC and PNC tracking system, today's, according to, I won't go to the NFHS survey because this is much talked about, and I believe there is newer data which is coming in. The very emphasis of this survey is basically to show how the services are not reaching the people for whom they are meant. We have the institutional delivery, which is still at the 41%. Mr. Sinha says 73% has gone up, but still there is much more which needs to be done. We have 49% of the deliveries which has been done by the health personnel. And more than the ANC, the PNC is the one which is, after the ANC has been done, the PNC is much lesser. Only 1/3 of the women receive any postnatal care. So considering this background, and further, if we were to take up the workload of an ANM, which has been talked about, that the workload is 1 AM, and now after coming of the NRHM, we have 2 ANMs. It's catering to something like 5,000 to 10,000 of the population. If we take the birth rate, so for example, in Wardha it is 16, she's looking after 100 births per year. That means 100 mothers, after that the 100 children to be looked after for immunization, and couple and all other things put together. Similarly, if we say the government, I'm looking at the public sector, we have 2 doctors for a 30,000, that is a normative. You may have only 2 doctors, say, for 50,000 of population. So the point is that we keep a diary to tell us as a reminder, this is pending and we have to do it. But there is nothing like this for these ANMs and the doctors who are working at the field with the workload they have, to remind them that this work is due. So in order to ensure that we have a proper ANC tracking system, we started the use of mobile phone to track each and every ANC and PNC cases. I won't go into the goals. Goals are self-explanatory. So how do we do it? How do we do the tracking system? This is a part of a M governance. What we have done is we have given every ANM a SIM card. They already have a phone. If you go to the villages now, the whole village scenario has changed. You will find a very poor person carrying a mobile phone. They may not have a TV or anything at home, but they'll be carrying a mobile phone. When we did a survey, we found around 80% of our ANMs already had a mobile phone. So what we did is we asked the other 20% to buy them on a loan basis. We gave them a SIM card and formed a common user group. After that, we have a server at the district level, and that server is linked to a mobile phone. We do a tracking through the SMS base. So what happens is, suppose a woman is to be registered. Her pregnancy test has come positive, she has to be registered. So what our ANM does is, she sends an SMS. An SMS will give all the data. Say for example, her age, the ID, her weight, her previous issue, how many children she had before, is she eligible for Janani Suraksha Yojana, is she a BPL? All these information will be given through an SMS. We have a syntax for the SMSs. After that SMS is sent to our server, the mobile attached to the server will take the SMS. The software will convert that SMS into the data, and that data will form, there is a page for the lady which get formed, a kind of a maternity card, which you have it in a paper maternity card. Here you'll have a soft maternity card which will be formed. And what the computer will do is, the software will do is, it will generate her expected date of delivery. What are the dates when she should be getting checked? Like for Maharashtra, the 5 checkups are compulsory.